everyone. Myself, Renita Flavia Monteiro, Assistant Professor, Mental Health Nursing Department, Yenepoya Nursing College, Yenepoya deemed to be University. Today, I will be explaining about personality disorders. And to begin with, let us just have a look on the specific learning objectives. So learners will be able to define personality disorders, which is also abbreviated as PD, discuss the incidence, prevalence, and the etiology, and list the types of PDs, understand the clinical manifestations of PDs, explain the treatment modalities, discuss the nursing interventions for patients with PD. So to introduce the topic, firstly, we will have to know a little bit about what personality means. So personality is derived from the word persona, which is a Latin term, but basically used by the Greek dramatist to exhibit the characters during the drama. So it is nothing but theoretical mask. So later on, this particular word was used to elaborate on what is personality. So it is nothing but, it is deeply ingrained patterns of behavior, which includes modes of perception, relating to and thinking about oneself and surrounding environment. So it is nothing but how a person exhibits himself in his or her own surroundings. So what is personality disorder then? So personality disorder results when personality traits become inflexible, maladaptive, and cause significant social, occupational impairment, leading to subjective distress. So when a person is not able to flexibly use his coping mechanism, not in an adaptive manner, in different situations of life, leading to his or her own distress, we call it as personality disorder. So coming to the definitions, here I have two definitions. First one given by ICD-11, which is International Classification of Diseases 11th revision, and it says personality disorders are disturbances in both self and interpersonal functioning, requiring these disturbances to be enduring, which means lasting for at least 2 years, and manifesting in maladaptive patterns of cognition, emotion, and behavior, which means nothing but maladaptive patterns of thinking, emotions or feelings, and how a person acts. So similarly, we have another definition here, which is given by DSM-5TR, which is Diagnostic Statistical Manual 5th text revision, and it also says similar like ICD-11, enduring and inflexible patterns of thoughts, feelings, and behaviors that deviate significantly or markedly from cultural expectations, causing distress or impairment. Now, cultural expectations can be a particular way of dressing, a particular way of behaving, a particular way of greeting one another when we are meeting in the society. So when somebody doesn't meet this criteria or behaves in a very different manner, a person deviates from the cultural expectations, leading to distress or impairment. So let's see about the incidence. What are the statistical figures in terms of personality disorder? So globally, general population, 6 to 10% of the people suffer with personality disorder. And out of them, the common ones, antisocial and borderline personalities, are identified to be the commonest and are estimated to affect 0.7 to 2.7% and 0.7 to 4.1% respectively. So instead of a single personality disorder being identified, there is a common identification of a mixed personality disorder often seen in patients who are diagnosed having personality disorders. So more than one type of a trait is exhibited. So in Indian setting, the prevalence is of around 1.07% among psychiatric outpatients, with anxious, avoidant, and borderline personalities disorders being the most common. So these personality disorders are not being diagnosed on its own. That means the patients don't approach the hospital or for the treatment on their own, because most of the time they are not aware of it. So often these disorders are diagnosed along with some mood, anxiety, substance use, depressive related disorders when they come to seek treatment to the hospital or an outpatient basis. So coming to the causes, to know more about the causes, the research so far has not identified one particular cause leading to this personality disorder. So the exact cause of this disorder remains unknown. We have other predisposing factors which are identified probably leading to personality disorder causation. So one of them are genetic. So certain traits like characteristics of a person's personality, aggression, it may be anxiety, fear, like the emotions which are really difficult to be expressed, or the vulnerabilities, temperament, like how a person behaves in the society, can be passed down through families. Like you must have heard of people saying that, oh, one of the parent was very angry most of the time, easily getting angry. That particular trait can be passed down to one of the child, and that particular trait can itself lead to, if it goes to extreme, can lead to personality disorder exhibiting one of the traits in the causation of the personality disorder. So genetic can be a predisposing factor. Then along with that we have environmental factor. So in environmental factor, it can be early life experiences. So if a child goes through a traumatic experiences, physical, emotional trauma, abuses, neglect, not receiving enough attention from the family, unstable family environments like separation, violence, these kind of situations going in the family. And if the child is exposed in the early years of life, later on there is a chance that the child would develop some personality disorders. Then we have other things like insecure attachment with the parent or caregiver experienced by the child, social and cultural influences, which I explained when I said about the cultural expectations. When a person behaves very differently from what is expected, if continues and goes to extremes, can have other difficulty in his functioning, causing distress, and that also can lead to personality disorder concerns. So now going to the types of personality disorders. So far we have seen about what are the traits, what is personality disorder. So based on the different types of behavior, under mental health conditions, it's been tried to put or classify under different types so that certain types of disorders can be diagnosed because they have different nature when comparison from one to another. So ICD-10, that is International Classification of Diseases, 10th revision, includes specific types individually under F60 category. So we have around 10 types which are listed down, and they discuss about the clinical manifestations, how the diagnosis is taking place, and what is the treatment modality. Now ICD-11, which is the current ICD classification which is in practice for diagnosing the conditions. So it is based on specific trait domains, negative affectivity, detachment, dissociality, disinhibition, and anancastia. And it also mentions about the severity of the personality disorder, like mild, moderate, or severe. So negative affectivity is nothing but the person views his or all relations, anything in the person's life quite negatively. Detachment, social withdrawal is the main concern. The person is not able, believes that he cannot maintain any relationships, intimate relationships. Anhedonia, dissociality, disinhibition, more of reckless behavior, impulsivity, these kind of things are seen in disinhibition. and anancastia, which is more of perfectionism, trying to control others, having a kind of controlling behavior on others. These are some of the things seen in anancastia kind of a trait. So next, moving on to the another main type which we are going to discuss in the further slides, that is the types which are given by DSM-5-TR, and this is basically categorized based on the behaviors described by or exhibited by the individuals. So the three types of behaviors are identified. Firstly, the cluster A, the behaviors exhibited are odd or eccentric. Now, something strange, something unusual, you don't get to see it in a daily basis. The person tries to behave in that way. So under that, there are three types classified: paranoid, schizoid, and schizotypal. Cluster B is the second classification. Under that, the behaviors which are described are more of dramatic, emotional, or erratic. So erratic are quite changeable kind, labile we could say is another word. So under that we have four types which are given: antisocial, borderline, histrionic, and narcissistic. Then the last one is cluster C. Under that, behaviors described anxious or fearful, and the types include avoidant, dependent, and obsessive compulsive. So there are total of 10 types which are under three different clusters based on the behaviors exhibited by the individuals. So cluster A, let us go into the details, a little bit of understanding on what each type means based on the clinical manifestations or symptoms that they present, and what is the basic characteristic of this particular type of a disorder. So paranoid, they are characterized by pervasive, which means persistently exhibited in most of the aspects of their life, distrust and suspiciousness over others, with an unwarranted, without a particular reason, belief that others are trying to harm or exploit them. So they always believe, most of the time their expressions would be difficulty to trust somebody on simple things. Most areas of their life are affected by this kind of a behavior. So it begins in early adulthood, often leading to depressive and anxiety disorders. So somebody coming with depressive and anxiety disorders, maybe they would be also diagnosed with paranoid if certain traits are seen. So they use projective defense mechanism here mostly. This is the defense mechanism seen in patients with paranoid personality disorders. So what are the symptoms? As I said, they exhibit suspiciousness, doubting over small things without any particular reason, mistrust, sensitive, argumentative, stubborn, self-important ideas are something which are given importance to. Hypersensitive, they react in a very quickly, and this particular reaction could be out of proportion to that particular situation. Jealous and irritable. So next type is schizoid under cluster A, and this is characterized by detachment or social withdrawal. That is a more important characteristic here. They don't get involved in the social activities, they try to isolate themselves, and introversion is a defense mechanism. They love to be in their own company, used to avoid psychological discomfort, perceived social rejection, finding comfort in limited emotional expression. They try to keep themselves and not really get mingled with anybody in the society. So some of the symptoms we can look here is emotionally cold, aloof, detached, humorless, introspective, no desire in close relationship, inability to experience pleasure, that is nothing but anhedonia. Schizotypal is the third type under cluster A, so which is characterized by pervasive pattern of social and interpersonal deficits, discomfort with close relationship, cognitive and perceptual distortions, eccentric behavior, and social anxiety. Now I said eccentric is very kind of odd kind of a behavior. They use magical thinking, odd beliefs and social avoidance as defense mechanisms. So to give an example, if a person has this particular disorder, that person may think that something what is happening in his environment is directly linked to him. It may not be the case, but that is his belief system, and he would take actions based on his belief system. If somebody is talking about someone in the society, he may refer it to himself. So these are some of the things which are not really rationalizable. We cannot rationalize it. They are not realistic, but the belief system is so that the person's behavior is reflected, and that is why, which is very unusual to be seen in a normal society. So what are the symptoms include? Social isolation, odd thinking, beliefs and speech, unusual perceptions and suspiciousness. So schizotypal is closely, we can relate it with schizophrenia, but it is not schizophrenia on its own, because in schizophrenia we have much more of psychotic presentation which is not seen in schizotypal. Though it appears in certain sense, the characteristics still reflect some of the traits, but schizophrenia is full-blown psychotic disorder, while schizotypal is not. So we have discussed on the three clusters, cluster A with the three types, and now moving on to the cluster B. First type under that is antisocial. So it is characterized by pervasive pattern for and violation of the rights of others, often lacking empathy and remorse. So somebody who is suffering with antisocial personality disorder would not feel guilty about the actions, whichever extreme conditions it must have caused harm to others, till there wouldn't be any guilt or remorse, and they wouldn't reflect on the consequences because they don't understand that part of it, and they lack empathy towards others as well. So correction of their behavior is difficult because they lack awareness. So uses denial, projection, identification as defense mechanisms, and some of the symptoms that include disregard for the feelings of others, impulsive actions, all of once without understanding the consequences of the particular action, low tolerance to frustration, tendency to cause violence, lack of guilt, failure to learn from experience, reckless, disregard for own or others' safety, impulsivity and failure to plan ahead. Very manipulative, self-gratification is something which they look for, inability to maintain close personal or sexual relationship. So this is the way the symptomatic presentation looks in antisocial personality disorders. Then we have borderline personality disorder, characterized by pattern of instability in interpersonal relationships, mood, behavior and self-image. So they use splitting. They can see the extremes, good or bad, but they don't see in between the line, between good or bad. They don't understand that part. Projective identification and acting out defense mechanism. They are less expressive, but most of the time they make know what they want and their thoughts and feelings with the help of actions, but they do not verbalize to somebody who wants to know that. So what are the symptoms include? Unstable relationships. They get into a lot of relationship issues, emotions, unstable emotions, self-image, impulsivity, lack of control on anger, recurrent suicidal threats, uncertainties about personal identity, feelings of emptiness, stress-related dissociative symptoms, acting out of feelings instead of expressing them appropriately. So this is particular, they want very changeable way of a presentation, and that is why they get themselves complicated when it comes to emotional expression, because they are very labile in nature. They have unstable self-image because the particular thinking what they have on about themselves may not last for long. Unstable relationships because they have difficulty in understanding each other. Moreover, overwhelmed with particular emotions without knowing how to handle one's own emotions, which gets in difficulty with the others and in turn having unstable relationships. So that was about borderline personality. Next is histrionic personality disorder. So it is characteristically have a pervasive pattern of excessive emotionality and attention-seeking behavior, and are drawn to momentary excitements and fleeting adventures. Common in females, uses depression, denial, and dissociation defense mechanisms. What are the symptoms? They include dramatic emotionality, craving for novelty and excitement, shallow and labile affectivity, attention-seeking behavior, over-concern with physical attractiveness, exaggerated vague speech, self-dramatization, impulsivity, suggestibility, egocentricity, self-indulgence, lack of consideration for others. So more of egocentric way of looking at oneself, so much involved in oneself, very dramatic way of a presentation. Expression is more of dramatic, it looks more of dramatic than real, and it keeps changing. Very labile way of emotional expression. So this is a presentation of a histrionic personality disorder individual. Then we have narcissistic as the last type in cluster B. They are characterized by self-centeredness, self-absorbed, and lack of empathy for others. Uses projection, denial, devaluation, splitting as defense mechanisms. So the symptoms include inflated sense of self-importance, more than what they are actually are. They crave for more importance, and they would present themselves whichever way they want. They can devalue themselves anytime, and they can change their identity, present in a way that they are very dramatic, unable to face criticism, lack of empathy, exploitative behavior, arrogance, preoccupation with fantasies of success, power, beauty, brilliance, or ideal love. So this is about the presentation of a narcissistic personality disorder. So we have seen 4 types under cluster B. Now moving on to cluster C. The behaviors are described as anxious and fearful behaviors. So the first type under this is avoidant or anxious. It's characterized by feelings of inadequacy, extreme social anxiety, social withdrawal, hypersensitivity to others' opinions. So very hypersensitive presentation, emotionally reactive kind of, inadequate in extreme social anxiety. The social presentation, they operate in terms of anxiety, they withdraw themselves or isolate themselves from the social situation. So avoidance is the common defense mechanism seen in this category of personality disorder. And the symptoms include persistent anxiety, apprehension, inferiority complex, fear of criticism, rejection, unwillingness to be involved with people, excessive preoccupation with being criticized or rejected in social situation. So they avoid these social situations because they are anxious and they find it hard to face different situations, so they mostly avoid them. Next is dependent personality disorder, characterized by extreme need to be taken care of, which leads to submissive, clinging behavior, fear of separation, rejection. So here they use submissiveness, clinging behaviors as defense mechanisms. So they have fear of separation, so they just get attached to somebody and do not want to come out of them. More of acceptance, attention, validation is accepted by them from those whom they cling to. So the symptoms include subordination of one's own needs, inability to take decisions, unwillingness to make even reasonable demands on other people, feeling uncomfortable or helpless when alone. They always need somebody's company, low self-esteem, they can't take decisions, lack of self-confidence, hypersensitivity to criticism. So they always look upon to somebody to decide what they have to do in their life. So this is about dependent personality disorder. Lastly, under cluster C, we have obsessive compulsive disorder, which is characterized by pervasive desire for perfection and order at the expense of flexibility, of openness and efficiency. So they are less flexible, they are less open, and they don't mind, don't look into efficiency of what they are doing, but it is more perfection driven behavior. So the uses, they use intellectualization, reaction formation and undoing defense mechanisms here. So the symptoms include feeling of excessive doubt and caution, preoccupation with details, rules, lists and schedules, perfectionism, rigidity and stubbornness, high standards. They try to maintain those high standards and they ask for it, and flexibility, openness and efficiency is not of consideration when it comes to perfectionism and meeting the details, rules, lists and schedules. So that was about obsessive compulsive personality disorders. So we have seen about the types under 3 clusters, cluster A, B and C, and now we'll move on to understand what are the treatment modalities available to manage these conditions. So as I said, this particular disorder is identified when people seek treatment for other types of disorders like mood related, anxiety related, substance use, depression are the commonest ones. So medications is not a primary treatment here. Antidepressants, anti-anxiety, mood stabilizing may be helpful in treating some co-occurring symptoms or comorbid conditions. Psychotherapy is a primary treatment, can help a person understand the effects of their behavior, learn to cope with these symptoms and to reduce the behavior or change the behavior affecting functioning and their relationships. So psychotherapy is a primary treatment which has different types of psychotherapies which are used based on the patient's needs and the type of personality disorder they are diagnosed with. So some of the commonly used types of psychotherapy include psychoanalytic or psychodynamic, transference focused. These are types of behaviors, therapies which are basically exploring the unconscious mind to identify what are the problems which are not seen, and they help to resolve those kind of psychological problems which are identified. Psychodynamic works on the long-term emotional growth and it also aims at the self-awareness. And transference focused is more focused into the same area of unconscious mind exploration, but it focuses on the therapeutic relationship between the therapist and the therapy. So the next type is dialectical behavior therapy, cognitive behavior therapy. It is nothing but they work on understanding the thinking pattern and to change the dysfunctional thinking pattern, to challenge them and in turn change the thinking and in return the behavior what the patient exhibits. So more of dysfunctional to functional, impaired to healthy patterns of thinking and behavior. Group therapy is something in which the patients learn from each other who are going through the same types of conditions. They learn from each other the challenges they face, how they cope up with different kinds of difficulties they have due to what they suffer with. Occupational therapy is basically helping the person to lead an independent life by learning certain skills based on their interest and to improve their quality of life. Recreation therapy, it is basically based on the relaxation techniques, and also certain physical activities are involved. So again, it is based on their interest to help them use their energy, change their mood or regulate their mood, emotional expression in a more healthier manner so that they can lead more of productive and balanced kind of lives and improve their quality of life. So psychoeducation to individual and families is also an important part which is covered in psychotherapy. So here an awareness is given with regard to the disorder to the individuals who are suffering and also to the families so that they can cope, help them support and help them to cope with this particular type of disorder. So constant support can help these individuals to lead a good life with a better quality of life and be productive. So these are some of the types of psychotherapy which are commonly used to treat personality disorders. So next, moving on to the nursing intervention. So if a patient is admitted in the hospital or a nurse comes across a patient who is having personality disorder and comes across, as we have seen, different behavioral issues which we come across with these kinds of patients, how do we manage them, or what are the actions which can help the person to recover or to gain an awareness into the disorder. So firstly, we need to accept the person as he or she is by the labeling or maybe identifying them with their behaviors. So providing a safe environment, especially in case of self-mutilating behavior, they can self-harm themselves. So in those cases, when we identify those behaviors, we need to give them a safe environment, keep them away from all those harmful objects. Close observation is required on those patients who can self-harm. Set and maintain limits with consequences. Limit setting is also important and it works well when priorly you inform about what behaviors are acceptable and what are not, and if unacceptable behaviors are exhibited, what are the consequences that they are going to face. And keep sticking on to that, and that helps the person to be aware and try change the person's behavior. Encourage the patient to take responsibility for his or her own behavior. Encourage the patient to openly express feelings and thoughts and not to be hesitant. So encourage the patient to be emotionally expressive, whatever bitter or hard these emotions and feelings are. Identify triggers of acting out behaviors. Patients, when they show acting out behaviors, they have some unmet need which they are not able to talk it out. So they try to show it in their actions or behaviors. So we need to identify that and encourage the patient to talk about it rather expressing it in a maladaptive manner. Maintain alertness to manipulative behaviors of the patients. Communicate the problems with manipulative patients to other team members so that a consistency is maintained in our approaches and they don't make the use of these inconsistencies and the behavior continues unnoticing. Provide positive feedback to patients who are making efforts to change the behavior. So we need to reinforce the patients when they show some changes in a positive manner or they are making some efforts to change their behavior from maladaptive to adaptive. Encouraged to participate in therapeutic activities. So right channelization of the energy is happening, and they don't use the maladaptive way of exhibiting their characteristics when they interact with the people around them. Encourage the patient to keep a private journal of thoughts and feelings. Now, private means it is not going to be seen by anybody. It is for themselves. It is a way that they can put forward their thoughts in a form of writing, and it is all expressed in that manner. So that penting up of emotions in the mind is going to be avoided. Discuss with the patient how his or her behavior affects others and assist to explore alternative actions. To help them to look into other options available, because they are going to restrict themselves by looking in one point of view. So we can give them with different choices and ask them how they would go with in order to have a healthy relationship in the society. Observe and intervene before escalation occurs. So we need to identify the triggers before even the person comes out with the emotional outburst and then it goes out of control. So de-escalation techniques can be used, and for that we need to identify the triggers timely. When acting out behavior is shown, use timeout technique if patient is resistant to redirection. We can use the redirection method first, but if it doesn't work, then timeout is the technique which will be apt in this situation. So the timeout is nothing but keeping the patient away from that particular thing, what is happening at that point of time, temporarily or for a short duration. Assess for suicidal ideations. Some of them may have self-harming ideas. So do an assessment for the suicidal ideation and develop a no-harm contract with the patient with self-destructive behaviors. So no-harm contract is a contract which can be done verbally or in a written manner, asking the patient to put it down or to verbalize, to say and take promise that they will not harm or kill themselves if they get the thoughts of self-destruction. So these are mostly the nursing interventions which are need-based, can be used need-based and based on our assessments, because we have seen that different personality behaves in a different way. So identifying the characteristics and using the right nursing intervention becomes important. So to summarize what we have learned today, and I have explained about few things to understand this personality disorder. So I've discussed about the definition, incidence and etiology of personality disorder, the types of personality disorder as per DSM-5 TR. We discussed that there are 10 types under 3 clusters, A, B and C. Treatment modalities for personality disorder. Nursing interventions for patients with personality disorder. So conclusion, I would like to emphasize on the main takeaway from this learning session. Personality disorders are mostly identified when an individual seeks treatment for other conditions like anxiety-related disorders, depressive disorder, and bipolar disorder. Psychotherapy is the primary treatment modality used. Medications are used sometimes to manage the symptoms or to treat co-occurring conditions. Quality of life of these individuals can be improved when we give them an experience of psychotherapeutic interventions, psychoeducation, and when they receive constant support from family and friends. So, improving the quality of life is possible when they get enough support and the adequate exposure to the psychotherapeutic interventions. So here are some of the references from which today's content is covered. You can have a look. Thank you.